Hey guys, Thor and Zena says hi, and they're ready for the lesson today. Hi everybody, this is Dr. Teachout from Dansville Family Dental Care, 585-335-6170, 191 Main Street, Dansville, New York. Hey, I thought about we talking a little bit about toothpaste and toothbrushes. So those are the things I'm just gonna, just give my recommendation, what I talk to my patients about. Well, there's several toothbrushes on the market for adults and teens. Of course, you have to, I might recommend you the best toothbrush, but you don't get, very comfortable with it. So what I recommend for you is get a soft bristle toothbrush. One that you feel comfortable, that is not gonna hurt your gum. It's wrong to think that a medium too hard bristles, it will do the job. No, it will not. What does the job is the technique. It starts from one point on the outside surface of your teeth, walking all the way through to the other side, and then moving back to initial point for the part of the tooth inside, which is the lingual part of the tooth, walk itself back to the end of the point, and then brushing back to initial point on the top of the teeth, which is the occlusal surface of the teeth. So again, just trying to demonstrate to you. So you start, so imagine this is my mouth, okay? So you would start on the side of the teeth, the outside part of the tooth, which is the buccal, brush all the way outside through the other part. So then you would open your mouth, put the toothbrush inside, and brush the part of the lingual part of the tooth all the way, starting to this point and work itself to the other side. Then you come back again on the top of the teeth, which is the occlusal surface, brush from the point where you start the beginning and work itself to the other side. So you're done, but don't do it fast, just take your time, because you're removing all the particles, those dogs. Anyway, so now work again on the bottom, on the other arch, and you're done. And use a good toothbrush that's soft, that you feel comfortable with. But I just don't want to stop about talking about toothbrushes. I really recommend Sonicare. And it's not that I have stocks with Philips. I don't buy stocks on Philips. I just think it works because it's a sonic, it's gentle, and you don't have to do anything. You just put on your teeth, and then we'll brush and we'll do the whole movement for you. Make sure that you're touching the gum line, not the teeth. See the difference? Make sure that you're touching the gum line, because that's where the plaque starts over here. So make sure that you go all over, touching the gum line. Again, going back, the lingual part of the tooth, and then the occlusal part of the tooth. I just think this is a very unique technique that this toothbrush has. It's a good toothbrush, so I recommend that to everybody, included because they have one that's for children as well, has a good handle, and that's a good habit to start. If you see that it's just like they're not doing the job well, they find, oh, it tickles me. It's a great toothbrush to have, Of course, they have several electric toothbrushes on the market, but we have the other one that we have, which is the brown. I particularly don't like much because of the movement they have. As you can see, they have rotation movement. And with that, if you have a condition called recession of your gums, more likely this is going to injure even more. So I don't recommend it. See it all? And he says that, He's like, oh no, don't use that on me. Anyway, so that's what, but if this is what you got, doesn't matter. You just gotta do a good job, making sure that you brush all the surfaces of your teeth, that you keep in contact on your gum line, and that you do a throat-out job throughout your mouth there. After brushing, I also recommend a good, fluoride rinses. Fluoride rinses like ACT, ACT, they have orthodontic type, they have fluoride. It must have some fluoride. It's just because even though if you are in a fluoridated water, we don't drink tap water sometimes, we're in a bottled water. So fluoride is one, it's like the vitamins for your teeth. In those areas where you have initial of a decalcification, the fluoride is gonna help you to have a remineralization of the area. We also have fluoride tablets that you can ask your dentist if your child, if you don't have the fluoride rings, they can't speak, so that the fluoride tablets, they can be useful for them to chew, and get the fluoride that they need to prevent cavity as well. Again, I just would like to touch up a little bit about toothpaste, because there's several kinds of toothpaste. What's the best toothpaste? The one that you like. But on my experience, I do not recommend no abrasive toothpaste. There's a part of the toothpaste, it's called silica, and silica can be very, very, very harmful to your enamel and actually harm your enamel. So I recommend a good toothpaste that has fluoride. That's the main objective. Now, of course, there are people who doesn't like fluoride, and sometimes they want a more organic toothpaste. So Tom's is one toothpaste that doesn't have fluoride, but on my understanding, fluoride is a very helpful ingredient that will help with to prevent cavities. So as you can tell, I just brought some here for you guys to see. Some people, for example, when they have already some demineralizing situation about the tissue or middle of the teeth, when the teeth has already presented with a high risk cavities, they have already a lot of cavities, or they have those white spots where the enamel has been decalcified, maybe you will need a prescription toothpaste, and that's what you get from your dentist. They have a highly concentrated fluoride, and you brush with it and you actually do not rinse, but stays in your mouth so that the fluoride works on the area where you have already developed some decalcification and beginning of decay. Or if you are, for example, on chemotherapy or any type of cancer therapy that require a better care, with your teeth, so I more likely would be recommending you to get a prescription toothpaste, or for example, in my office I sell those. Those are available right there for the patients to use, those toothpaste. Also, we have what's called Ramen Pro. It's a pure fluoride. It's a product that helps with remineralization as well. So after you finish, your braces and you come up with all those white spots, because you didn't take care of your teeth during the time that you had braces on. So I might be recommending you to use this all the time. And even during the treatment, during the time that you have your braces. This is another toothpaste that a lot of people are using with teeth. They are oil-based toothpaste. I tell you the truth, I've seen a lot of improvement with teeth in the gums for patients. However, one of the things that I notice is sensitivity, that some of the people develop because it's lemon-based. So I don't know if that's your case, but if you have used teeth and you start having sensitivity, it might be because, some of the ingredients of this toothpaste is not doing well for your exposed roots there. You have Crest Pro Health that has a bunch of ingredients. My husband loves that. That's what he uses, so that's another one that can use. You have some sensitive toothpaste, Sensodyne, and Colgate Sensodyne, sensitive toothpaste that you can try. And then one of the newest one they call was Gum Detox as well. They're very good, but for me, it didn't work as well. And the reason because it didn't work for me is because I have some recession. The recession occurs when your gum is just pulling away from the enamel a little bit and expose the root part of your teeth, and that's very sensitive. And because of that, I have to use a special toothpaste, and that's what I use. I use a prescription toothpaste every night, and I noticed that after a month, if I don't use that, more likely I will be having sensitivity, and that's why I stick with it. And also I do a rinse with Act Fluoride every night. And floss. That's what I recommend. Okay. So this is for teens and adults. So this is just a brief idea of things that I talk in my office. But if you want to check it out, my video for toddlers, some of the tips that I give for toddlers, please check out my other video that I did for toddlers. Okay.